And welcome back. And we're still in the same five-part video series. And today we are discussing, again, can a non-physician own a medical practice in Texas? And so far we've covered two questions. What is the corporate practice of medicine? Does the corporate practice of medicine exist in Texas? And now, Michael, we're going to move on to question number three. And this is the one that most people really care about is the corporate practice of medicine doctrine actually enforced in Texas?
Yes, and it really helps illustrate the maybe confusion you would have that we talked about in number two, question number two, about whether it exists in Texas. I had mentioned that there's some controversy and confusion because of the different laws that you have to pull together to see that this doctrine exists. Is much more clear when it comes on the enforcement side. So there's appellate cases in Texas that deal with this whole ownership of a medical practice issue and whether non-doctors can own and set forth their rules and boundaries on that. And then there are published Texas Medical Board cases that deal with non-doctors owning a medical practice. And then, Brad, you and I know from experience, there's a lot of non-published medical board investigations. And so we're on the front lines when clients call us with a board complaint and we see firsthand the allegation from a medical board saying, that you are conducting the unauthorized practice of medicine, or if it's a doctor, you're aiding and abetting in the unauthorized practice of medicine. And so we can say that the medical board, or at least the investigators, certainly view the corporate practice of medicine doctrine as alive and something that they will enforce.
Yeah, that's a good point. And again, for those who want more details, we do have a field guide that we have published that has a lot more information. But I think, as Michael said, there is a risk associated with it, which is the important piece. And even though in many cases these are unpublished opinions that we are aware of, that doesn't mean that those physicians, or in some cases nurses, aren't being pulled into long-term investigations and many years of their lives in which they're trying to get this stuff dismissed. But that's all the time we have for this particular one. So we'll look forward to speaking with you when we come up with part 4 of this video series.